Okay folks, now I want to take a few minutes and talk about some symptoms that you may be suffering with your thyroid condition. And these are some common ones that may be happening. Hair loss and thinnings. A lot of you have chunks of hair after you take a shower, they're just coming out in your hands. This is a thyroid condition and can be caused by a thyroid condition, and that's a serious problem. Tired or sluggish. Some of you trying to get up and get ready for the day, you cannot get ready for the day. You're fatigued, you're tired, you can't even get through a full day without taking naps, and you're just exhausted. That again could be a thyroid problem. Bowel difficulty. You could have constipation, diarrhea, upset stomach. You could have bloating. That bloating where your belly is just distended out to here. That could also be due to a thyroid problem or a thyroid condition. Depression. We see a lot of patients that are on thyroid hormone are also on antidepressive medications. That's very common due to a thyroid condition. Morning headaches. These morning headaches for most people seem to wear off in the middle of the day and seem to dissipate. But again, these morning headaches can be excruciating right from the very start, from you wake up, as soon as you wake up. Weight gain. Of course, this is an issue that most people that have thyroid conditions are concerned about because they gain weight so easily. They look at a piece of food and gain weight. They restrict their diet. They try to exercise and still cannot gain. They still cannot lose any weight and have a very difficult time losing weight. This is a big problem and a main issue we talk about. Cold hands and feet, where your hands are cold, your feet are cold, you got socks on your feet all the time, you're always bundled up, even sometimes in the middle of summer, you got cold hands and feet. Again, another issues and problems with thyroid condition. Hot flashes, these hot flashes are, for most women are not menopause, they're not premenopausal. There's a thyroid problem. It's a thyroid condition where the thyroid's not working right, causing these hot flashes. Mood swings. This is where you're tired, you're irritable, you're cranky with your spouse, your kids, at your job. You don't know what's going on. You feel like you're going crazy. This is the feedback I get with patients that have thyroid conditions. Nervous and emotional, same kind of thing. You get anxiety, you get the shakes, you feel like there's heart palpitations going along with that. Or you get night sweats. That's a big one too. Insomnia. Insomnia, you can't sleep at night. Or you get to sleep around 2 or 3 in the morning, you're wide awake with your eyes staring towards the ceiling and cannot sleep through the night properly. That's a big problem with thyroid patients. Night sweats we mentioned. Folks, there's a whole list, a whole laundry list of all these different medications. Dry skin, skin that really becomes itchy. We mentioned the hair. Chronic pain. Some of you have chronic pain at different joints in your body that can be going on. Again, these are all symptoms of thyroid problems. And folks, to be honest with you, most of these approaches, both hypo, hyper, and autoimmune conditions, it's all based on a 50-year-old model. It's a current medical standard. They just run TSH, maybe run your TF4, and if you're within the normal disease range, they're going to say you're normal. They don't know what to do after they put you on the medications, and that's why you're watching this, because there obviously is something going on with you. Looking at this, it's trying to break this down. Your hypothalamus, which is inside your brain, releases a hormone, and it's thyroid releasing hormone which stimulates the pituitary to release your TSH. The TSH levels, folks, I want you to take a look at your lab work, your most recent lab work. Your TSH levels, optimum range, should be between 1.8 and 3.0. 1.8 to 3.0. Those are functional ranges, folks. If you're lower than that or higher than that, you're outside functional range. We'll talk to you about that in a few minutes, why that's a problem. TSH then goes down into and causes the thyroid gland with TPO to release T4 and T3. Those are your hormones. T4, folks, is inactive. 93% of your thyroid, the hormone is produced is from your thyroid gland, is T4. Your body can't do anything with T4. It has to be converted to T3. And that conversion takes place, the majority of that conversion takes place in your liver. And in your liver, it also takes place in peripheral tissues as well as your intestines. So if you have liver problems, intestinal problems, and of course areas of the brain that are not functioning properly, you're going to have a thyroid problem, even though your lab test that says your TSH levels are within normal range We're going to talk about that quote-unquote normal range in a few minutes.